Baby got back. Baby got back.
To palpate the iliac crest, have the patient lying prone, and what you want to do is put your thumbs right on the PSIS, or posterior superior iliac spine. Have your thumbs run laterally, you should feel a curvature around, and that is exactly where the iliac crest is going to be. To palpate the lumbar spinous processes, have the patient lying prone. Place your fingers on the iliac crest and the thumbs on the midline of the back. Doing this, you should feel the L4, L5 interspace. If you palpate superiorly, you should be feeling the L4, L3, L2, and L1. Going back to the L4, L5 interspace, if you palpate inferiorly, you should feel the L5 spinous process. To palpate the sacral processes, have the patient lying prone. Locate the L5 spinous process using the palm of your hand. Move down inferiorly, and you should be noticing the bones getting smaller and smaller until you hit a flat surface. This is when you know you found the sacral processes. To palpate the posterior superior iliac spine, have the patient lying prone. Locate the sacral processes and move out laterally, and if the patient has visible back dimples, then you know you found the PSIS. Apply an adequate amount of pressure, as this may be tender to the patient.
In order to palpate the ischial tuberosity, have your patient lying prone. Bend the patient's knee up on the table, and palpating the midline of the buttocks, move inferiorly. You will feel a bony prominence. This is also known as the sit bones. From the same position as locating the ischial tuberosity, palpate laterally, and about halfway between the greater trochanter and the ischial tuberosity is the sciatic nerve. This area is very tender, so apply an adequate amount of pressure. Your patient might feel tingling down their legs. In order to palpate the greater trochanter, have the patient lying supine with the legs straight. Locating the ASIS, move inferiorly and laterally. You will feel a bony prominence. If you're unsure if you have found it, have the patient internally and externally rotate their foot. You should feel its head rotate. In order to find the iliac crest from the anterior position, have the patient lying supine. Locate the anterior superior iliac spine and palpate along the curvature. This is the iliac crest.
To locate the anterior superior iliac spine, have a patient lying supine. Put your hands on either side of their waist, and you'll feel bilateral bony prominence where your thumbs would naturally fall. In larger patients, this will be harder to palpate, so you can start on the iliac crest and move anteriorly until you find the bony prominence. To palpate the iliac tubercle, have the patient lying supine. Locate the ASIS and palpate about 3 inches above along the lateral lip of the crest. This is the widest part of the iliac crest. The femoral triangle is very difficult to palpate on a patient due to its location. The triangle itself is defined superiorly by the inguinal ligament, medially by the adductor longus muscle, and laterally by the sartorius muscle. Inside the femoral triangle is lymph nodes, the femoral artery, the femoral nerve, and the femoral vein. With fingers on the inguinal ligament, drop laterally and inferiorly inside the triangle, and you will be able to palpate the lymph nodes and the femoral artery. To palpate McBurney's point, locate the ASIS and the umbilicus. Draw a line between the two, and about 1/3 of the way up from the ASIS is McBurney's point. This is where the appendix should be, and if the patient has appendicitis, this will be very tender.
Baby got back.
Okay, hold on, I'm sorry.
That wasn't right.
And approximately halfway between the greater trochanter and the ischial tuberosity is the sciatic nerve. This area. Stop. God. Have the patient internally and externally rotate their foot, and you will heal.
That is exactly where the iliac crest is going to be.
Between the great, from the hip. palpating laterally.
To palpate McBurney's point.
Palpate laterally and halfway between the adductor.
Let's define the adductor.
Between the joint.